All right. Welcome back to another episode of the Black Surgeons podcast. Today, we have the privilege of having Dr. Ruth A. Olumba here with us. She is specializing in GYN and cosmetic surgery, but she's way, way more than that. So I'll give her the floor right now to kind of introduce herself on who she is and what she does. Dr. Olumba, thank you so much for being here.
Thank you, Dr. Bonelli. Is that how you say
Yeah,
your name? Yeah,
Wibonele,
wonderful.
Wibonele. Yeah.
Yes. I tried to use my African accent to pronounce your name. So, hi, everyone. My name is Dr. Ruthie Olumba. I am a board certified cosmetic surgeon and gynecologist or gynecologic surgeon, really. Um, I'm so excited to be here. Something that you don't know probably is I used to be a podcaster and I haven't recorded a podcast since 2021. So this is exciting to be back and talking about things that I love because I like to tell stories that inspire.
Yeah. Nice, nice. So tell us a little bit about yourself as far as where did Dr. Olumba come from and how did this whole thing get started?
All right. Well, so I actually grew up in Nigeria. I'm Nigerian. I grew up in Port Harcourt, which is a coastal city in Nigeria. And I moved to the United States and moved to Maryland as a youngster. I did do boarding school in Nigeria, which was really excellent because boarding school allows you to, and I went during my secondary school. I was actually the youngest kid in the school. I went in at age 8. Average of going in is around 10 or 11. So I went in at 8, so I was separated from my parents very early. And I went to school about 2.5 hours from where I grew, where my parents were based. I really wanted to go, and my dad told me that if you get a merit scholarship, you can go. And
Mm,
that wasn't because he couldn't afford it. It was because he didn't want me to go and didn't think that I would have like the wherewithal to do that at 8. So I sat my butt down and I got a merit scholarship. And so I ended up going to federal government college, or which is where I started my schooling. And a lot of the time was a blur. In retrospect, I was probably way too young to have been separated. I think I got a lot of trauma that happened to me that I don't really remember. But I do think that it sort of gave me the idea that if you set up a goal, you can accomplish it. Like if you have a goal, if there's some reward, and actually I've realized in my life that's how I am wired. So when we came to America, my parents put us, I did 1 year of public school, and my mom thought that, hey, her child is going to go wayward. So she decided that she was going to put us all in Christian school. So I went to Christian school and private school. I was the only Black human in my school, all white. And that I didn't really understand much. A lot of foreigners don't really understand a lot of race relations, I think.
mm,
And so going there, I had the same idea, right? Like put your head down and work. Because my parents told me that if I got straight A's, I could go to public school. And the only thing that I wanted to do was be around Black people that looked like me. So I wanted to go to public school. So the program that I was in is called a PACE program. And that
mm,
means that you can go at your own pace and you can finish the entire curriculum in a year, right? So
mm.
you could be in seventh grade, which is what I was in, and I finished the entire 12th up to 12th grade curriculum in a year. And I won every single award that was possible that year. So my parents had no choice but to honor their word. And I went to public school. But now they're teaching me a lot about the reward and the work sacrifice reward, the delayed gratification. So I ended up going to public school and I became an athlete and I really enjoyed. I was 3 sport athlete. I was a volleyball, basketball, and track, and I was a anchor. I ran the 4x1 and 4x2.
Wow.
And so I also really got into sports because my dad was an athlete. One of my dad's brothers actually ran in the 1992 Olympics. So
Wow.
I kind of had the idea that, okay, maybe I'm Nigerian. I can run. I can do something with my body. So I literally like learned a lot. It was again, reward. I loved like getting medals. So I recognized that my body was just like wired for rewards. I finished high school as a valedictorian, and then I went to University of Maryland. University of Maryland was great for me. I now finally found my Africans, and so I was not really super involved. I started off as an athlete, actually, as a red shirt athlete. And then when I realized I wanted to go to medical school, or I wanted to give myself the option of going to medical school, I dropped out of sports and I paid attention to school. I finished college in 2.5 years. And we were faced with this dilemma. Like, like, at this point, I'm like, what, 19 years old? Like, what do I do with my life? I had a 4-year full scholarship. So my parents were like, you have a 4-year full scholarship. And literally, I would like get a rebate for school, and I never paid a tuition. So, like, because I had a full scholarship, and then I won some other athletic scholarships. So I would get money back, and I never paid anything in. And so my parents were like, nobody's going to give you that. Go get another degree. So I added a second degree, and I finished both degrees in 4 years. And then at that point, though, I started to rebel because, like, now I've done everything that everyone told me to do so far. And my mom's a physician, my dad is a PhD engineer. So everyone's like, you're going to be a doctor, you're going to be a doctor. So I'm like, I don't want to be a doctor now. Right. I have gone out, I have partied, I have gone to ASA. I didn't drink any alcohol at the time. So I would go out with my friends and I would go and sleep 2 hours and go take a test and ace it, right? Like, I was one of those people. And then I decided that at that point, I was going to not go to medical school. There's no way I was going to medical school because I didn't want to be the like stereotypical African kid that went to medical school and did everything that they were supposed to do. What I decided that I wanted to do was I wanted to go and live with my mom for free. So, fun fact, my mom trained in Nigeria. She was a physician in Nigeria. When she came to America, she decided to focus on her kids. So she didn't practice medicine. She was a substitute teacher. She used to, imagine being a physician, you're a substitute teacher, used to like clean windows, just anything to allow herself to be around her kids and not take the time to do her USMLE steps and all of that, because you're going to have to do those again and go to residency. So when my youngest brother went to college, my mom then did all her exams, and then she was starting residency when I was finishing college again.
Wow.
So she was 51. So I decided that I wanted to go to where she was doing residency, which is actually Macon, Georgia, at Mercer. And I moved to Macon. I applied for an MPH. I started off at Macon, finished at Emory. And so I did an MPH and an MHA at the same time. So when I was in my MPH was a 2-year program. So when I was in my MPH program this first year, I was in this class called Epidemiology of Chronic Diseases. And I was in this class and I really understood how diabetes, hypertension, smoking, cervical cancer would affect a population, but I knew nothing about the diseases. And I sat there, I was like, what is diabetes? What is hypertension? Like, I'm learning about how it's affecting the population, but I know nothing about this. And that day I went home and applied for medical school because I was like, I wouldn't be okay living my life, understanding how these are affecting the population, but I really don't know the actual disease. So I applied to medical school, got into medical school, almost went to your alma mater, Morehouse, but I ended up going to UMDNJ, New Jersey.
Nice.
During that time, I had a brother who was in law school. And why I chose that is because he was going to law school in New York. He went to Fordham Law, and I was going to medical school in New Jersey. So we would be close together. My other brother lived in New York. My parents lived in Maryland. So I was right in the middle between the two of them. So during my second year of medical school, my brother passed away. He had sickle cell, and he didn't die from sickle cell. He died from a Dilaudid overdose in the hospital. Nobody was monitoring him. Nobody's checked on him. And then I started my storied relationship with medicine. So medicine is giving me my livelihood. It's also what gave my mother her livelihood. But here, medicine actually ended my brother's life, right? And so I started this like really hard. I mean, I remember like being a resident and like having a visceral reaction when I had to give someone Dilaudid, right? And In addition to that, the medical team actually treated my family really poorly because they had no idea who my brother was. They felt like he was just another Black body, right? And so that sort of started because I think with that experience, I never would have understood how medicine affects Black people in general. I told you my story in detail to show you that I was very sheltered in the way that I walked through. You know, I never felt like I was a affirmative action type of kid. I never really struggled to get into stuff. I mean, I would hear things like my college advisor, and I remember I finished college in 2.5 years, but my college advisor told me not to apply to medical school because I wouldn't get in. Well,
Mm.
I'm magna cum laude. How am I not going to get into medical school? I had an extremely high MCAT score. I mean, I got a full scholarship to medical school with that MCAT score that I only took once. But he told me not to apply, that I would never get in. When I was getting my MPH, I had a 4.0, and the advisor told me to apply to the Caribbean or go do PA school. And those things like that, they were subtle, but not really. I'm
Mm-hmm.
not really connecting the dots at this point. I'm thinking to myself that maybe it's just a one-off,
Yeah.
right?
Yeah.
Until I had this is the one experience that kind of shifted my mindset and started explaining to me that, medicine for Black people and with us as providers was a little bit different, and that I started to pay attention. Okay. So I remember going to residency. Residency was extremely tough for me. One of what I thought was the reasons, because I thought I wanted to be a dermatologist my whole life. And when my brother passed away, I kind of shifted. I started to think more deeply because my brother and I, being the same age, and then figuring out that, you could pass away at 24. Like, I started to think about my legacy, what I wanted to do. I wasn't just drifting through life anymore.
Mm-hmm.
So when I thought about dermatology and how I wanted to affect the world, I really didn't like the bread and butter, in that I really wanted to be a surgeon. But I thought I would do dermatology and become a Mohs surgeon. And when I really thought about the bread and butter, which I encourage anyone listening to this, if you're not at the point where you have chosen your career, aka you're a resident, um, really think about the bread and butter of what the specialty does. The bread and butter of dermatology is full body exams, right? And I didn't see myself going through, people's toenails and butt cracks looking for, changes that are melanoma or SKs or AKs, or, I didn't see myself doing that. And doing that for 4 years to be able to do surgery, right? So I started to think about what was a way in which I could really become a surgeon. So I actually went into OBGYN
Yeah.
to do fibroid surgery. And I figured that out because after my brother passed away, I went to Botswana.
Mm.
When I went to Botswana, I had a hairstylist who died. And she died because abortions in Botswana are illegal. So everyone crosses the border and goes to South Africa to get abortions. Well, she had a coat hanger abortion, but she had fibroids. And the
Oh man.
fibroid, she bled out, right? So
Yeah.
then that was my first real introduction to what fibroids were. I was already a third year medical student, and I
Mm.
started reading about fibroids. I understood that it affected Nigerian women disproportionately, Ghanaian women disproportionately, Ethiopians, Black women, women that look like me.
Yeah.
So I then went backwards and said, what specialty addresses fibroids? And so it was OBGYN. So then I thought I would do OBGYN, suffer through delivering babies, which I ended up loving,
Mm.
and then get to become a GYN surgeon. So that's actually how I chose that path.
I see.
And then I went to Georgetown for my OBGYN residency. I
Mm-hmm.
did a reproductive surgery fellowship, which are non-accredited fellowships because
Mm.
I wanted to get paid. And that's just the real reason. And they
Yeah.
paid me well. And I learned from a surgeon who passed away 2 weeks after I finished my fellowship.
Oh wow.
And he gave me everything. He knew he was really sick, so he gave me everything that he knew. And when I finished, I opened a practice in Mansfield, Texas. and I was doing fibroids. I worked with reproductive endocrinologists who were sending me women who they had extensive fibroids and wanted to keep their uterus because that's what I specialized in. So I was one of the first surgeons to do a lot of newer procedures like Acessa and Sonata in North Texas. And so I learned a lot during those 2 years. But the pandemic hit during that time, and you couldn't do elective surgery. So I started to think about what else I would want to do in my life. And my patients kept telling me, like, hey, I would like for you to like do my breast reduction, or because one thing that gynecologists have is a very unique experience and relationship with their patients. So your patients love you and they want to be with you long term. So I was the type of surgeon that my patients saw me, got their surgery, and went away because, so they're like, what else can you do? Can you do liposuction? Can you do,
Mm-hmm.
tummy tuck? So they actually started planting the seed. And then I met a friend who sort of introduced me to other people. And then I found out there are cosmetic surgery fellowships with which you can be of any surgical specialty and you can go into cosmetic surgery. So it was just basically serendipitous that I got to the point. I applied with 1 week left of the application cycle. I actually never interviewed. My fellowship director called me and offered me a position. I don't think it has anything to do with merit. I think it was literally God for me. And I started my fellowship, finished my fellowship. My fellowship was a dual accredited facial and general cosmetic surgery. So I'm dual board certified in facial in general, but I don't do facial extensively anymore. I really like to continue what I started, which is women's health, wellness, and then I added the beauty aspect. So that's basically me in 17 minutes.
It's
I talk
amazing.
a lot, but yeah,
No,
that's how I
no.
got to how I got to.
Wow, you have an amazing story. And it just sounds like you're a pretty ambitious person since like day one. And it sounds like it was like an innate thing for you. It wasn't like somebody was pushing you. There are some challenges along the way people gave you, but kind of like you just kind of attacked them head on and you went with it. I want to go back a little bit to some of the things you've pointed out, along your journey. High school seemed a little bit easier for you, undergrad, a similar thing. What do you think allowed you to succeed during undergrad and do so well? Is it
Yeah,
mainly just
undergrad.
discipline or what?
So I think the PACE program that I had at middle school is a very shaping year, shaping time of people's lives. That's when you develop a lot of your characteristics, right? Because you're developing really, really fast. Puberty is there and things like that, right? And so one of the things that helped me was the PACE program. You had to set your goals every day. So things that people learned as adults, like setting goals, planning, achieving goals, crossing them out, I started very, very early.
Mm,
So I think that for if I could teach anyone how to not just set really ambitious goals, that's the first thing.
hmm
Really ambitious, like blow your mind type of ambitious goals, and then set like smaller milestones or objectives to get there and daily put brick by brick by brick. The other thing is, I was really raised with a reward system.
mm,
So in my household, if you got an A, I don't remember the numbers, so I'll just use the numbers, like random numbers. If you got an A, you got $50, right? If you got a B, you had to pay $60. It was more than what you got for an A. If you got a C, it was like double. You're paying back my parents. I had no intention of ever either owing or going out net zero, right? So that reward system was very important. And I think the third thing was always having been an athlete. So, athletics to me, fitness, wellness, those kind of things have always been the anchor of my life, but they've also allowed me to. I feel like like that saying, I don't know if it's from the Bible or not, but it's the idle mind is the devil's. It's definitely not from the Bible. It's just probably a saying. Like an idle mind is the devil's workshop. So
hmm
for us, my parents always made us dual. They always told us you can never hinge your hat on athletics, but they always pushed us because my dad was an athlete, always
Yep.
pushed us into athletics so that we had less time. So I would, like, if I practiced at, my mom used to wake me up in high school to practice before school. So practice before school. When I came home after practice, I only have 2 hours left. I don't have time to watch TV, to play video game, to do any of those things. I only had 2 hours. So
Yeah.
those 2 hours had to be dedicated to work. And so I think that that kind of, and I've always thrived on minimal amount of time free. When I have all day free, it's hard.
Yeah. Yeah.
Those are the three things, I think.
I can definitely piggyback on, the business part of things. I had this similar background growing up where I was in like three sports and I was taking like AP classes. And so it's like, as a kid, you need that almost like all your time block to be arranged, right? When you have that free time, there's so much of that chance for you to go and do something stupid, essentially.
Yes,
And
exactly.
I think that was a mindset of my parents. It was just like, all right, I didn't hate it. I loved the sports, and so I was just like, man, I'm gonna do whatever it takes to do well on these sports. Maybe I'll be whatever NBA player or football player one day. It didn't happen, but I love the mindset of of your parents saying that you can be more than just an athlete. You should be a great student. This is the first time I heard this, paying back money for making a B. That's
My
amazing.
parents would not play.
For
My
me,
mom, it was her idea. Till today, I want her to pay me back. But yeah.
for me, it was more of like, if you get an A, you get money, but maybe the hierarchy was like A plus, A minus. You don't get anything for a B, but I've never heard of like getting a B, you're paying back $60. I'll probably steal that one.
So yeah, and what ended up happening is, how do you pay it back if you don't have a job, right? Oh, chores.
Exactly.
There's a lot of things you can do.
That's
So
funny.
yeah.
I think for a parent who would be hearing this, or especially where we are now, generational. I don't know. For me, when I look back, I'm like, I'm so grateful for what my parents did to set me up that way. But there are some kids who would be like, that was very traumatizing. What's your thought on that aspect of things for a parent who's listening? Is like, huh, that's not bad, but also I'm worried about how I'm going to be viewed as a parent.
Yeah, I think that's a really valid concern,
Hmm.
right? But I think that my mom always said, like, she's not my friend, she's my parents, and now we're besties. Like, I can't go a day without talking to her. So I adopt that because I think that, we're learning more about how children think, but I think that children are moldable, right? You
Hmm.
don't know what you don't know. You and I know, even at this point, we still have a lot of shaping to do, a lot of room to grow. So for a parent that's listening to this, I would recommend that you, and I'm not a parent, so I'm only saying this in theory, is that you take the time to learn your child and learn their weaknesses and their strengths, play on their strengths, and then help them with their weaknesses, and be empathetic to it. While I
Hmm.
think that it's probably the approach. My parents were very hands on and had a very good balance of good cop, bad cop. And so that helped me. My mom never cared empathetically what I was going through. Like, she's like, you're going to succeed, and that's that. And my
Hmm.
dad was a college professor, so he understood more about the, development stages. So he
Hmm.
spent a lot of time. So I think that also, if you have a partner, if you have someone that's raising these children with you, to partner with them, learn a little bit about how you guys can banter and move together. But children are not adults. Children don't have the same rights as adults. They're still autonomous, but they don't get to ruin
Hmm.
their lives because you are equating them to be your peer. I think that that's the responsibility that we have when we're raising the next generation. Because
Yeah.
you and I mean, it's the same thing. If you're an intern, right? Versus if you're a chief resident, you're not
Yeah.
having the intern, making decisions about who's in the ICU. You're not having the intern, directing the surgery. You're having the intern learn the skills that they will need for the next phase. And I
Yeah.
think that that level of graduated responsibility and autonomy is necessary in parenting.
Just to go back a little bit also, you talked about a little bit about your residency, and you said it was pretty hard. Can you kind of highlight a little bit on what went through those, the 4 years?
Yes, it was 4 years.
Yeah.
So residency in general, I think, is big shock to high achievers. You spend a lot of time by yourself. Everything that you do hinges on you. If you read, you study in the right way, study the right material, you're going to do well in medical school. Residency is more challenging because it has a lot of interpersonal relationships and interactions. I had a different layer of added to my residency because my residency was a merged residency. Georgetown and Washington Hospital Center merged, and I was the first class that it was completely merged from beginning to end. So the chiefs that graduated before me, they were the first year that they started to integrate. So now they have completely phased out anyone that has any idea that this exists, but then the culture still existed. Georgetown was predominantly a white institution, and Washington Hospital Center was predominantly a Black institution with both patients and physicians. So with that clash, there was a lot of things that happened. A lot of things that happened, to one point where I was forced to go to communication class because they felt that I was too sassy with my answers. So the chief of OBGYN wrote, one of the brightest students I've ever had the pleasure of teaching, but she's extremely sassy with her answers. Sassy was just me being confident with the fact that you told me to read this. I read it. I know what page it's on. I know what paragraph it's on. You want me to prove that I know what I'm doing. Here it is. But my response was too confident is now
Mm,
being called sassy.
mm,
That communication class was every Tuesday for almost a year. It was the best thing that ever happened to me
mm,
because although it was supposed to be a punishment, what ended up happening is that I learned how to navigate in the corporate world in a way that I never would have. Okay.
wow.
I witnessed this similar. My mother was a physician, a geriatrician, and she was the first Black physician in this government owned healthcare center, the biggest nursing home in the Eastern Shore of Maryland. And when she was there, she was just doing her thing. It came up that there was going to be the chief was retiring. And for whatever reason, they expected that she was going to submit her name for this position. Now, of all the other physicians there, she was the only geriatrician. Everybody else were retired internal medicine, general surgery, whatever. They were all now there, but they were not trained to take care of older patients. That's what a geriatrician is, if someone doesn't know. She also has an MBA. So you would think that she's the best fit to be the chief of geriatrics, right? But my mom had no intention of applying. But she went through a almost witch hunt. I mean, it was so insane what she went through because they were trying to make sure that and I was young then, I was in medical school then, and as I was watching it, I actually joined in trying to dissect my mother. Like,
Mm,
what did you do wrong? Like, this cannot, like, your brain could not accept that this could really be because of your race and your sex or both,
mm,
right? I couldn't, it couldn't, my mind couldn't wrap around it. But I will say that she went through, I mean, this was taken to court. She went through a 5-year legal battle and won. Okay.
wow.
And the reason why she didn't settle, they wanted to settle very early. The reason why she didn't settle at that time, I was Dr. Rumala. Dr. Olumba is my married name. So
Mm,
Dr. Rumala, there are only three of us, my dad, my mom, and I. And my mom was like, my daughter has a whole career. If she never gets married or decides never to change her name, she is Dr. Rumala. And I want to make sure that when she's looked up, that there is no trail that could be misconstrued, trail of bad behavior that could
mm,
be misconstrued with her name. So she wanted to clear my name in its entirety. I say all that to say that, I didn't understand. I didn't believe it. I still go through it. I had a recent case in which a nurse lied about me completely. Those are things that happen. Okay. they will happen as long as you interact with people who don't understand or believe that you should have the position that you have, the expertise that you have. They have no idea the sacrifices that you made. They don't think about the sleepless nights, the weddings you missed, the funerals you missed, the interactions you missed, the way that you couldn't stack up money like your peers did. They don't think about the loans you took. They don't think about the relationships that you sacrificed on the altar of medicine.
Yeah.
All they see is the authority that you have and the shell with which you are in, and they don't believe that those are congruent. You should be anywhere in the allied field serving people. You should not be the captain of the ship, period, point blank. So understanding that allows you. I spent a lot of time, especially in 2020,
Mm.
being of the idea that it was a new era and we could fight this. But as you know, there's a backlash at the moment.
Yeah.
And so, how do you navigate this? That's where
Mm-hmm.
I am, is how do you navigate this and come out unscathed? Because honestly, what I have recognized is that the forces that are against you, whether it's systematic or individual, don't
Mm-hmm.
just want to end your career. They actually want to destroy you where you're not able to sustain yourself, right? Because a lot of us, our livelihood has become who we are. And if you're listening to this and you're a medicine, try to divorce yourself from that idea.
Mm.
I am a physician, right? I practice medicine, but I'm Ruthie first, right? I'm my husband's wife first. I am my friend's friend first. I'm my parents' daughter first. I am not a physician first, right? And I
Yeah.
feel like once you divorce that as your primary and only identity, it liberates you a lot.
That that is like one of those things that I feel like during residency I've really tried to hone on because it's hard. You're spending 24, 48, constant time in the hospital. And so it's like, you see your coworkers more than you see your significant others, your family. And I think during that time is when your identity shift really starts, even for medical school, because you spend so much time just like honing in into this craft. And now you feel like this is who you are. And I think as people go on in the journey and maybe you fail or something happens, it just breaks you because it's like all your identity was Ben the ENT surgeon or Ben the medical student. Then that didn't work out and it just crashes everything that you have kind of been building up. And so that advice is like golden, to be honest. Like since from medical school, you should just realize you're a medical student, but that's not who you are.
That's not who you are.
You're more than just that medical person. I don't know why for some reason in medicine that is such a thing, a tie between your career and who you are, because not everybody else does that. It's like, if you're a software engineer, it doesn't mean that's who you are. People have lives outside of that and they live their life and they're enjoying it and they don't put their worth on that, if that makes sense. And so thank you for mentioning that. It is such a big identity shift that for me was like, okay, this is just part of me. This is not the whole of me.
Just, I think that it is on purpose.
Mm,
On purpose because I believe medical education is a form of brainwashing, but it's
mm,
a positive form of brainwashing because I want to be able to come to you and you give me the same opinion as if I went to Zimbabwe, if I went to Australia, right? Because
mm,
we're taught a specific way of evidence-based medicine. So I think that there's a bit of a break, like you have to kind of sacrifice self a lot in our profession. So it's a little because imagine going through like what I've gone through, right? I have a friend who she is a fellowship trained child and adolescent gynecologist,
mm-hmm.
and she quit her job to become a content creator.
Wow.
And she's doing a lot better in terms of time sacrifice
Mm,
for the amount of money that she makes. She makes way more money. So compensation is there. She helps way more people because she, as a physician, can only help one person at a time, right?
hmm.
She's
Yeah.
creating content around gynecology, right? She speaks at conferences. And she has time to take care of her son. She has
Mm,
time to be a wife. She has time to take care of the other things herself, right?
mm,
But imagine the like brain shift you're going to have to make to have been only dedicated since 4 years old, wanting to become a doctor, becoming a board certified physician at 34, 35, and making that full mind shift.
Yeah.
Some of us couldn't do it,
It's scary.
including me, because
It's
I've
scary.
considered it. I can't do it. Like, to me, it's like, how can I have sacrificed all of this and then I do something with which a degree is not even like, some of us have 5 degrees, this and that and the other. Like, you think about all your sacrifice. So I think it's on purpose, because if not, there will be no physician workforce. Because if you really sit down and think about it granularly, who works 48-hour shifts? Who works 72-hour shifts? Who is in the OR for 12 hours a day? Who has trained their bladder not to, so that you don't have to leave the OR to go pee? Who are the type of people that can literally like drink water and go talk to a patient, and that's all you had for a whole day? Like, think about the thing, like, when it's not human, it's like cruel punishment if you think
That's,
about it on a granular level.
yeah, yeah. I mean, yeah, the work it takes to be where we are, just to be a surgeon, it's unbelievable.
Yeah.
I guess to continue on that note, for somebody who is a pre-med student who's wants to take on this journey, or a medical student who wants to go into OBGYN or cosmetics, what advice would you have for them as they're like thinking about doing this?
Cool. Thank you for asking that question at this time in my life. I would have given you a very different story when I was a resident, fellow, or otherwise. But I'm at the other end, so I have a vantage point. First of all, is that, I would say that life, you should not live your life in a silo. Make your decision. This is what you want to do, but recognize that you don't want to wake up one day and recognize that you never dated. You're 38 and you've never dated. Well, you start dating at 38, you're at the level of someone that's 21 or 18, right? So
Mm,
don't live your life in a silo. Date, find time to travel. Put your coins together and do things that bring you joy. Work out, eat healthy. Your life is not in a silo, okay?
mm,
You have to develop yourself as you're going along, because the things that make you an amazing, amazing surgeon will make you a horrible partner.
mm.
It will.
Oh,
That's why it's hard to date surgeons. The things that make you a beautiful surgeon, you're dedicated, you're one-minded, you are obsessive, those make you a horrible partner. So you also have to learn how to be a partner.
mm.
Okay. And I'm not preaching at anyone, I'm learning through this experience also.
That's good
The
advice.
second thing is that comparison is a thief of joy. If you compare yourself to your dermatology friend who's going to finish in 4 years, is going to be making 375, 450, and you are still in training, you're going to be miserable. Or you finish with somebody who decides that they're going to go to the middle of bum F nowhere, Wisconsin, and make triple the amount of money that you're making, and you can't make that sacrifice because you got 3 kids, you're going to be miserable. Okay. If you are going to compare yourself to the person who then decides to become an entrepreneur, also, who was your like, that person, you graduated valedictorian, that person graduated last in your class, and that person can buy you and your entire ancestry, well, you're going to be very miserable.
Yeah.
So my idea and my you are in your own lane. Your lane is perfect for you. Okay. And the last advice I would give is faking it till you make it will help you and really aid and abet you never making it.
Mm,
I used to believe that you just fake it till you make it, you fake it till you make it. Until I met this person very late in my career. My co-fellow in cosmetic surgery, he is one of the most intelligent people that I know. But this man will ask the dumbest questions, and because he refused to fake it.
mm,
And that's how he became so intelligent. He asked questions. He opened up a textbook, and I know that a lot of people have U World, Pathoma, this and that. Everything is in a textbook, okay? Review books are just that. They help you pass exams. Everything is in a textbook. Someone else has done it. Someone else has looked at it. Like sometimes when I go back and read textbooks at this point in my life, I'm like, I looked for this answer for 10 years. It's right there. Everything's in the textbook. Ask questions, read, study. You know, I think this is an African proverb that if you wash your hands well, you can sit with kings. Okay, so that idea is preparation. If you wash your hands well, you can sit with kings.
Yeah. You know, I always tell people like if you're studying to for an exam versus you're studying to learn, that's like one of those things. It's like once you're this far out, you know, when you're in your training, you just start to realize, I'm like, huh, this is not about passing a test anymore. It's actually about me taking care of a human being. And what's a better way of you starting to have that mindset since you're in medical school, right? It's like you're learning it and you're actually engaging. It's like your mind is already going to be molded in that way where you're like, okay, there will be a patient someday. I might see this. And how do I want to learn this material in a way that it's going to really like come into my mind and actually really like I can picture what I'm going to use it for. It's hard in medical school because you don't have that tangentness, but like now I'm here seeing patients and I'm like, okay, like I'm not just learning it because I got to go take a test. Yeah, I got to pass my boards, but it's because I actually have to know where this nerve goes and I have to know if I give this person this medication, this is what's going to happen. And so that's like an amazing advice to give somebody who's like starting out, because that mindset, if you start that way, I feel like it's going to take you a long way as you
Yes,
go on.
I agree.
um so I had maybe a couple more questions. Thank you again for, I think we're more than 30 minutes in, but it's been a great conversation, so we're gonna keep it going a little bit more.
Yeah.
As far as access, you mentioned a little bit, you were almost blinded by, the race issues because, you came to the US, you were in a private school, you never really got into a lot of intrications until maybe medical school residency time. But how do you think, as far as, as minorities, we can improve access and representation for underrepresented groups, especially in these subspecialties, in surgery, in GYN, in cosmetics?
That's a really good question. Okay. And any of my mentees will tell you, I don't tolerate anything but excellence. I'm like, there's a lot of the older school physicians. If you ever speak to anyone over 50 that's a Black physician, you will hear they don't tolerate anything but excellence. They don't tolerate, they push you to excellence. I used to actually, the first time I ever got scolded by an attending was I was a second year resident and a Black attending pulled me to the side and he said, "What rubbish was that? How dare you have a morning report like that? Are you crazy? Like you're representing me. You look like me. Like are you stupid?" Like literally that's what she said. And I
Mm,
was like, these people are insane. Like, but now I get it. Okay? So you shouldn't go as from a position of begging. That is the number one way that you can find access. You're not going there like, please take me. My tests suck. My grades are trash. I can't listen. I don't have a kind personality. But take me. I'm gonna make a great doctor. I don't care what race you are. So you can't even
mhm,
start from a position of mediocrity from any race, right? And then, I hate to also be like my parents because they used to be like, you have to do double the work. Now, do you know what double the work does? It backfires on everyone else. You're double as good. Doing double the work makes you double as good. I mean,
mhm,
maybe that was the whole sassiness response was because I was so determined that I was going to be that good that I really knew my stuff. And it allows you to become more of a empathetic physician, right? Because you kind of know what struggle you went through. The other thing is, I hate to say this because it's hard to do it while you're in training, but great when you're out of training, is don't lose yourself, right? If I'm giving a talk or a presentation, I will switch, I can code switch real quick to my accent. I I wear what I want to wear. I do what I want to do. I have never switched up. And there were times that I did. I shouldn't say I've
Mm.
never. I have not switched up at this point in my life. There were periods in my time that I was a chameleon and I wanted to fit in and I code switch. And I think that you're going to have to play the game for a period of time, but never forget who you are. Be true to your core self. That's who you are. Long term, that will give you access that other people won't give you. I recently heard, I think it was on Instagram, Oprah talking about her some of her roads to success. And she said one of the things that was great is they never counted me in. I was always counted out. They always counted me out. So when I would negotiate, I would say I want 90% of my rights. And they're like, well, your rights are going to be what's 90% of zero? Nothing. Right.
Mhm.
So take it. And they didn't recognize that people were going to love her as much
Mhm.
because they and respect her as much because they didn't love her as much or respect her that much.
Mhm.
Those things. Now, the other thing is really about access. Align yourself with Black physicians, Black doctors who are where you want to be and are also accepting. I have to add that other part because there are some physicians that want to be the only one. I learned that the hard way, right? So there are some of us that want you to be right next to us, some of us that want you to be our bosses, some of us that want you to take over our practices. There's some of us that want you, but there are some that want you to be beneath or not exist. You
Mhm.
have to find strategic alignments. And if you are spiritual or prayerful, that's something you should pray for. Is to
Yeah.
pray for people that you find favor with and people that you can align yourself with, who can pull you along. Because I've had those and I've had the opposite.
Mhm.
So, you'll hear the story like all skin folk and kinfolk, and that's because there's caution, there's wisdom and discernment that aligns. That's just something that makes you know that this person is somewhat like you, but you still in that have to use wisdom.
Yeah. That's powerful. Well, all those are amazing, amazing advice. Just to finish up, I want to ask you so far in your career, what's been the most rewarding thing or moment?
I love this. So there are really two.
Hmm.
One of them, because I have two specialties, I'm going to talk to my both of my specialties. So I had this patient who had necrotizing fibroids. So what that means is that the fibroids had outgrown the blood supply. So it was dying at the same time. It was still there. Her fibroids were huge, but when they're dying, they're soft and mushy, and they don't have, and you will understand this being an ENT, is the surgical planes are blurred.
Yeah.
Okay. In ENT, I know a lot about ENT. I was explaining it to Dr. Ben because my fellowship director was an ENT. And one of the things I struggled with was learning about surgical planes.
Hmm.
So now that I know surgical planes in its entirety, the problem with that patient is the capsule of the fibroid was mushed into the uterus itself. And my job is really to peel off the fibroid and reapproximate and reconstruct the uterus. And unfortunately, I was very certain that I wasn't able to do that really well. So I gave her, hey, I did the best that I could, but I'm not quite sure if you're going to have the result that we want, which is for you to get pregnant. My greatest joy was when she called me and told me she was pregnant spontaneously. They had tried IVF 3 times and failed. She was pregnant spontaneously. And then when she sent me the baby born full term,
Wow.
that was it for me. That was one of the most rewarding because even though I thought that I did a subpar job, and I probably did, we still got the end result. So that was really amazing. The second is I had a patient that came to me. She had she's the largest breast reduction I've ever done. Okay.
Mm.
Did a breast reduction and a tummy tuck for her. And she's in her 50s. She has twin adult children, and she's actually very on a high trajectory in her job. So she's in the corporate world and in management. And so she told me that, hey, she's turning 50. She wanted to give herself this gift. She's tired of carrying around these huge bags of breasts. She can't, like, her back is hurting. She can't stand up tall. One thing I noticed about her, because I'm a fashionista myself, is she came in, she looks super amazing. She had on a Hermes necklace, not necklace, sorry, necktie that was really vibrant. She had vibrant shoes and a vibrant bag, but she was wearing black. And every appointment that we went to, she was wearing black. So we finished her surgery. She was very thankful and all that. Then she came in for her 6-week follow up, and she had on a paisley shirt, print shirt, and bright blue pants, and she had a black bag. So I didn't know how to approach this to her. And I said, hey, I love your bag. I'm not a black bag girl, but I love this bag. Because I always compliment my patients on one thing.
Mm-hmm.
My patient said to me, this is my first black bag I've ever bought because I always wore black. And since I did my surgery, I've been able to wear color. I've been able to see my life in color.
Wow.
That for me, I mean, people think that what I do is really frivolous, but we change people's lives. We help women feel more comfortable in their own skin. And
Yeah.
so that for me, and then she called me after that. She told me that she was on the trajectory and she literally like took off because her confidence is so different. So she got put on a presidential training program that would have taken her, she said, 4 or 5 years to get to. They immediately put her on it when she started showing up at work, being more comfortable, more confident. So those kind of things to me are like my greatest joy. The surgeries
Nice.
that I do themselves, they're cool. They're fun. But what I really do, people, is I give women back their confidence.
Mm.
That's what I do.
That's pretty amazing. I don't think we can top any of those moments right now. Again, thank you so much for making the time and doing this with me. Great to hear your story. Whenever I do this, I feel like I come out very energized. And this is
Yes,
why I like doing it. It's just because like you hear about other people's stories and what they're going through, and hearing your patient successes is like, now that I'm gonna be an attending in the next year or so, it's like things to look forward to.
yeah.
So I really appreciate you, and I'll keep you updated with everything.
I'm proud of you for having this podcast. Amplifying Black voices in surgery is something we don't have very often. I think people think this is a privileged group of people, even though I do feel privileged. I don't feel super elite. There's a difference.
Mm, mm,
Um, I feel like we have a lot to do in terms of encouraging the next generation because I think that there's a lot more vocality and emboldenedness against the group of people that we are. So if you're hearing this, you can do this. We're both human, and everybody else that's here is just another human being that just took
yeah.
extra steps to get here.
Hey guys, so thank you so much for watching another episode of the Black Surgeons podcast. If you haven't already, please subscribe to get more material like this. And also by you subscribing, it helps spread the word and for more people to view this channel. Again, we appreciate you guys, and we'll see you on the next podcast.